Hello and welcome to the CEO Masterclass. I'm Peter Switzer. I'm talking to Dr. Graham Kelly, who's the Executive Chairman of Noxopharm. And this is a very interesting Australian story. Graham, thanks for coming on the program.
Thanks, Peter.
Noxopharm, what is it?
Well, drug development company, biotech sector. We listed back in August 2016, so heading towards our third year. We have what we believe is a transformative technology. We're focused on cancer, and we are in the clinic with this candidate, and we're hoping to see good progress.
Okay, now a lot of people watching this wouldn't understand what it means to be a biotech company with a goal to achieve something brilliant in a certain passage of time. They wouldn't understand the time and all the hoops you've got to jump through. So why don't you explain what cancer you're trying to beat and what you expect the timeline will be for success in a full product on the market sense?
Yeah, let's start with the timeline first. Yeah. It's a long time. You know, typically it takes between 8 and 10 years before you start to see revenue. But for biotech, the value can come well before that. Yeah, I mean, if you want to get your drug to market and be a seller and marketer of a drug, that's fine. But most biotech, their horizon is well before that. They're looking at either a total M&A situation or a licensing or some partnering, and that can typically happen after about 4 or 5 years.
And so what you're explaining is that bigger companies eventually see the real potential of a company like yours, and they either buy in or buy you out or whatever. And
all the big guys, if we look at maybe the top 30 pharmaceutical companies in the world, they're almost all running out of their so-called blockbuster drugs. These are drugs that deliver revenues above $1 billion a year, and that's what sustains these guys. And
it's like Pfizer with statins and all that sort of stuff.
Exactly. Yeah. And in the case of Pfizer, they had the biggest selling drug of all times. It was a drug called Lipitor. And back in about 6 years ago, they were doing sales of $12 billion a year, which is probably $15 or $16 billion these days. Now that does an awful lot of sustenance. But they've all gone. Lipitor is now generic, so the sales have come right back. So what they're doing is they're looking for companies like Noxopharm, who tend to be a bit cleverer and take the risk, and then these guys can come in after we've made the investment and decided that there is something positive there. So these guys still have deep pockets, so it's better for them to wait, see what's looking active, and then go in and buy it.
So what kind of cancer are you going after?
Well, we're currently testing it mostly in prostate cancer, but this is a drug that works across pretty much the full spectrum of cancer. And there's a couple of unfortunate truths about cancer, and one of them is that we've really not made a huge amount of progress over the last 40 or 50 years. Yeah. We've got better at diagnosing, we've got better at operating early, but if you are unfortunate to have a cancer which has gone beyond its primary site and is now what we call metastatic, or you've now got secondary tumours around your body, there is no magic bullet. And we're still using treatments, chemotherapy and radiotherapy, that we used 40 years ago. We have not gone forward. And what Noxopharm is attempting to do is to do something totally different. And about 10 years ago, we woke up to the fact, medical science woke up to the fact that cancer is a problem of the immune system. That normally our immune system is very good at recognising and getting rid of cancer cells when they pop up. And so for a tumour to be established, this is because they're switched off that immune system. Okay. And so at the moment, we all the treatments we're using, chemo and radiation, is based on just destroying. We're just looking to destroy the cancer.
Destroy.
Yeah, and unfortunately, you're also destroying the good parts, the good things of the body.
Immune system as well.
And one of those things you do destroy is the immune system.
Yeah.
And people would know that people on chemotherapy are very susceptible to lots of infections.
Yeah.
And that's part of the problem. Now, what we're doing at Noxopharm is trying to work with the body to overcome the cancer, whereas at the moment these therapies are working against the body, and that's why they're not fully effective.
So, is this the drug? Is it pronounced Vyondra?
It's called Vyondra.
Now, why is it called Vyondra?
Well, one of the challenges with any new drug is coming up with a name that hasn't been trademarked, which is typically why you get a lot of X's and Z's and Y's in drug names. Look, there's nothing more than that.
Okay, I thought there might be something ancient, historical about the immune system and stuff like that. That would have been nice. All right, so what makes, well, I guess you may well answer the question, but is there anything else that makes Vyondra unique? Because it seems to me working with the immune system is quite a unique thing compared to what the rivals. Is there anything else that you think special?
Well, it's the way it does it, Peter. These so-called immuno-oncology drugs came to market about 5 or 6 years ago, and they arrived with an enormous bang. And they were going to reactivate the immune system. Once the immune system got juiced up, it was going to attack the cancer, and that would be the end of cancer.
Yeah.
Now, if you are lucky enough to respond to these drugs, you do very well. But unfortunately, the majority of patients don't respond. It's as black and white as that. You either respond or you don't
It's
respond.
only a small percentage that respond well, is that what you're saying?
Yes, they do, and they'll get many years, particularly in patients with melanoma and lung cancer, that you can see quite remarkable responses. And but unfortunately, the vast majority of patients do not respond. Now, what our drug does is it works on the immune system too, but it works across the full immune system, and the immune system has got different parts to it. And these highly valuable drugs that are out there now, drugs like Keytruda and Opdivo, they only work on one part of the immune system. So our drug Vyondra works on the full spectrum of the immune system, and that's why we believe we are seeing the results we are, where we're getting quite significant anti-tumour responses in our patients.
Okay. Could you imagine some people who just have poor immune systems using this drug just to improve their immune system?
Well, most people who have advanced cancer do have poor immune systems. It's just part of the disease process. Your body just gets run down.
Yeah.
So yeah, it needs to be activated. But if you're in that state already, and then you use radiation with them, maybe with chemotherapy, what you're doing is clobbering that immune system even more. So it's a little surprising to people like me that we're not getting significant, survival outcomes with current therapies.
I would imagine a lot of people in the medical fraternity would love your drug to make it because it comes from the right angle. So where is Noxopharm up to? And I think some people here wouldn't understand the question. So explain what would that mean?
Right. Well, we're in the clinic, and
What's that mean?
we are testing our drug at the moment in patients with late-stage cancer.
Okay.
So when you have a new drug like this, you have to start at the end of the process. You can't take people who have been newly diagnosed with cancer. That's just part of the deal. You have to start with patients who have lost all hope. They've run out of options, and that's where you start. So the hurdle is set very, very high, and so we're dealing with patients at the moment with end-stage prostate cancer. These are men with stage 4. They've reached the end of their treatment course. They've got progressive disease. There's a lot of tumours in the body, and what we're doing is applying. Well, they're taking our drug, but we're applying radiation to just one lesion in the body, one out of dozens is just getting irradiated. And what we're trying to do is to activate the immune system in that lesion, and that could be anywhere in the body. And once you activate the immune system, then that you raise the immune system all over the body, and then we hope that eradicates all the tumours in the body. And that's what we're starting to see.
That sounds very positive. Okay, so do you need FDA approval in the long run? Because a lot of people I've talked to, those are part of the goal because it's America, isn't it?
Well, it's a long hard haul, and that needs to be acknowledged.
Yeah.
So we're at the start of that process. We're in what's called phase 1, which is where you're testing just to make sure the drug doesn't do any harm.
Yeah.
You don't make things worse, and happily we can say that. One of the features of this drug is that it actually does little harm to the body. So that's the first thing. And at the same time, you're hoping to see some evidence that is working.
Yeah.
Now that's where we are, and we have got that evidence. That's the good thing. You then move into the next phase, which is now we're going to maybe test our drug versus an alternative form of therapy. So you're comparing our drug with something else, and if you can then demonstrate that there's a benefit, you then go into your final form, which is where the FDA comes in, because that's the data they look at, and if they say, well, they think there's a good enough benefit from the drug, then you get approval and you're on the market. Now that, as I said earlier, that whole process can take about 8 years. But and if necessary, Noxaphone will go the whole distance. But we believe it's far more likely, based on the data we're seeing, that a large pharmaceutical company will knock on our door at some point in the next few years.
So if an investor was thinking about that, just run through the kinds of developments that could result in an uptick in the share price of Noxaphone.
Yeah, I mean every pharmaceutical or every company that's working in the oncology or cancer space is looking for an improvement to get that uptick. But I can say that with a lot of confidence that almost every other anti-cancer drug developing company I know of is looking at some sort of incremental benefit, where they're looking at maybe one particular form of cancer and they're looking to extend survival from, say, 12 months to 15 months. Yeah. That's the sort of incremental benefit that we've been seeing. What we're looking to do is something far beyond that. Yeah. So it's really a case of how much is somebody going to be prepared to pay for something that might be very transformative, and that's the game we're playing in to make this drug an incredibly attractive asset for an acquisition.
Okay, so you listed at 20. You're around 49.50 cents now. You're as high as $1.80, I think you told me. Does that reflect that the market gets ahead of itself and over-speculation gets in there?
I think so, yeah. I mean, there's with any new listing, there's always a bit of hype and a bit of expectation, and then I think maybe a year or so later the reality check happens where the investor realises that this is not going to happen overnight, and that this is something that takes some years, and you've got to crawl before you walk, and that's what we've been doing. But at least we've almost 3 years out from listing, we know we've got a drug that is delivering a clinical benefit in these patients who have no other treatment options left, and we're doing it without toxicity. So it's a very, very well tolerated drug. So we believe we're underway. We're on our way.
Okay, mate. Good luck. Great to talk to you. And I should throw one last question in. You know, you're a PhD. You know, I presume in medical science research. Is that a fair?
Yeah, I got my PhD is in medicine from the University of Sydney.
Okay. So how do you take that skill set and end up, heading up a publicly listed company? Was that a difficult step to take?
Well, it was a steep learning curve. I mean, it was a big thing to leave academia and to do this. But I learnt early on that if you've got a good story, this comes back to what do you bet on, the jockey or the horse? I mean, the horse has got to be good enough, and I always felt that the story we had was the Winx equivalent of drug development, and that hopefully I was a good enough jockey to ride this horse. And that's it. I mean, I've enjoyed doing it, and we've enjoyed some success.
Yeah. So far, so good. Nice to meet you.
Thank you.
That's Dr. Graham Kelly, who's the Executive Chairman of Noxaphone. Thanks for joining us on the CEO Masterclass.